Greetings, it is Deidre. Welcome back to Masters of Health. We are joined by a new guest, Angela Frazier. Yay.
Hey, thanks for having me.
Is the founder of Sisters in Public Health. So, Angela, I'm going to turn it over to you, and so you can kind of introduce yourself again, because I just did. What do you do? What's your profession?
Yes, my name is Angela Nicole Frazier. My gosh, I wear a handful of hats. That's the joy of being in public health, right? There are so many different fields and areas, from community health to biostats to epidemiology. My focus, however, is community health. My main focus is around mental health and suicide prevention. Although, again, I wear several hats as far as founding the nonprofit Sisters in Public Health, and also I'm the author of a kids book about suicide.
Awesome. Tell us a little bit about. I didn't see that when I was. Tell us a little bit about the book.
Yeah, so the book, well, let me take you back. So that's all a part of my story. And so in 2016, I actually was applying to get my MPH at UT Health School of Public Health. I went the first week of April to go down to Houston for the first time to visit it. I recall talking to my mom about it, really being excited, telling her how like the admitted students day went, and I was going to officially accept admissions.
Mm-hmm.
Well, about 2 to 3 weeks following that conversation with my mom, she ended up taking her own life. And so I went from going to school to really further my education in global health to taking a turn, right, and going into mental health. It took a little bit of time. I would say about a year of just kind of processing that, right? Processing a sudden loss in that way. And eventually I said, well, this is really important to talk about, especially in the Black community. I wanted to bring more awareness around mental health and suicide prevention. And with that, I knew that there are, kids that are unfortunately taking their own life. It's the second leading cause of death for ages 10 to 34, which is, it's huge, right? And so if kids are taking their lives as early as 10 years old, I wanted to write a kids book about suicide to really start bringing conversation, healthy dialogue around suicide prevention, around mental health. I wrote it in two different parts, right? So the very first part really talks to the kid who has lost someone to suicide. And the second part is about the kid who struggles with suicidal ideation themselves, letting them know, of course, that they're not alone. For the kid who's lost someone to suicide, letting them know that it's not their fault. It's okay to balance those emotions, right? There's a lot of emotions that come with losing someone from suicide. Some days I really miss my mom, and I'll always miss her. And then some days I feel angry with her, and both of those emotions are okay to have. And so I just talk to kids around that as well.
Okay. If you don't mind sharing, what are some of the reasons, like some of the statistics? Because I have another question, but I want to get to, like, we might have questions about that. What are some of the statistics for the youth who are contemplating, or as you said, have ideations of suicide?
Yeah, well, the biggest one is that it's the second leading cause of death amongst kiddos who are, anywhere starting at 10 years old.
Mm-hmm.
We don't see it, unfortunately, in the classroom. It's very, unfortunately, it's not a lot of statistics around like the classroom, or who are, are we talking about it? It's really low, unfortunately. It's not a lot of mental health advocacy and just education for kids early on.
I guess what I'm asking, like, is it bullying? Is it, things going on?
Yeah.
What is, what? Yeah.
Yeah. So, as far as like warning signs, like risk factors, bullying, is a huge one. Childhood abuse, neglect, unfortunately, molestation, things like that went early on.
Right. Okay. I just want to hop over to the chat real quick and welcome our audience. Greetings. Good evening. Chief Yuya, Sovereign Eves, Priya Bisa, and top tier speakers. Thank you for joining us. If you have questions for Angela, please feel free to put them in the chat. We'll have much more to discuss. So I'm going to back up even a little bit more, Angela, and ask you to share with us. You talked about like what public health fields you cover, community health. Thank you very much. what other, like, what are the job sites? This might be like a weird question, but like, because I've had like so many different people, and people think health, they're like, oh, hospitals, oh, clinic. But that's not necessarily the case, because if you're a researcher, you might be in the field, you know. So what are some of the job sites that have been in your profession, or at least that you've been at, and give examples of places that you've been stationed?
Yeah, good question. I first started off as a grants and communications coordinator with Bradley Engel, a nonprofit located in Portland, Oregon. They offer services for survivors of domestic violence. I later on ended up opening up the Tammy Best Shelter in honor of my mom under the umbrella of Bradley Engel. Domestic violence advocacy, mental health, things of that sort. I then went on to work which was not an exciting role for me, but it was a volunteer coordinator at a Houston Methodist. It's the #1 hospital in Texas. It's a great hospital system, but it just wasn't really the path for me. But that's the joys of being in public health. You get to touch a lot
like,
of.
I'm gonna try a little bit of this, I'm trying a little bit of that.
Right,
I'm
exactly.
gonna go over here.
See what's fitting. And then now I work as outside of obviously Sisters in Public Health, but I work as a project manager for Harris Health System, and we work with the most vulnerable population in Harris County. So Medicare, Medicaid, uninsured patients there,
Right.
and I do more of the outpatient side of things.
Right. Vulnerable populations, like, that's key, especially when you're working in community health, because vulnerable, whether you're vulnerable, underserved, you know, these are the populations, there's gaps that still exist. So absolutely, that's awesome. So tell us a little bit about your path. So I do like for people to know, because if you're a public health student currently watching, or you just graduated and you're kind of struggling, it's helpful to know, like, if someone had the same path as you, similar, or just like what it was in general, so they can see, like, you know, even if they may have an idea of like, oh, this is where I want to be, they can also, you know, from listening to people who are already like in the field and actively working, well, this was my pathway, right? And so that can give them an idea of how to move. So how did you become a professional in public health, or doing the work in public health, specifically community health? What was that path like? And you can even start it like what your major was.
Yeah, I'll take it back. I'm gonna take it back to undergrad.
Okay. Way back, because we all
that's where it started. So my gosh, in undergrad, it was two defining things. One was I was really on the path to be a doctor. That's everybody is either. I feel like a lot of people going to public health, they were like pre-med or pre-nursing, and then we stumble upon public health. And I was taking a global health class with Dr. Don Richardson out of Portland State University, and I just loved it. Global health was just like, it was just, like I said, that was the path I was originally taking. It was so interesting to me. And these students came into class one day and they gave us the opportunity to go overseas to do global health for 2 weeks. And so, of course, I signed up and fundraised and all that good stuff because I had to like participate in this. And I went to the Dominican Republic. Went to one of the rural communities, start working on like a daycare building up there, teaching English. I mean, it was really like this great experience. I loved it. And so for me, I was like, I'll have to take this opportunity, right?
Mm-hmm.
And then time had passed, and I was like, okay, I feel like public health, those are the classes I really liked. You know, I realized within my undergrad years, anything around health, disparities, just all of that, the social determinants of health. I was so intrigued with that. And then, you know, I went on to my route to UT Health. And once I got there, like I said, originally global health, but it changed pretty fast. And I wanted to just do community health, and I didn't want to specialize anything, right? I was like, I don't want to dive in anywhere. I just want to take classes in all areas, from, you know, leadership courses to the EPI courses, the biostats, the health promotion, behavioral sciences. I just wanted to overall to be able to kind of touch on everything, to really ultimately decide, like, you know, what do I actually want to have as my concentration. And I truly never picked like a specific concentration to graduate. I just did community health practice and really touched on a little bit of everything.
Okay, that's interesting. So now, tell us how you started Sisters in Public Health.
Yes, that's my baby.
It got dark. It got dark.
Did it?
Yeah.
Oh no, is it still dark?
No, I can see you. It's just very dim right now. bit.
Okay. So the start of Sisters in Public Health, you said?
Yes.
Okay. So, my gosh, 2016 is when I started my MPH. And fall of 2016, like I said, I just lost my mother just a few months prior. And I realized that, first off, I'm a part of a sorority. And so sisterhood is really important to me. I was going to a new city. It was going to be new people. Of course, you didn't have any friends. And I just immediately was like, I got to start something. You know, we had something during when I was attending Portland State called Empowering Sisterhood. And it was just about Black women getting together. And so I just really loved how we really had that community. For Sisters in Public Health, I wanted to think, broader in the sense of I wanted it to be very, very inclusive. I wanted it to be, I wanted it to be all about connecting all women in public health. And so I just kind of developed it out, made sure to do a lot of like outreach, of course. I laugh at the first flyers are like my Gmail. So it's like RSVP at A Frazier 1991 at Gmail. Like it cracks me up when I look back at it. But I mean, it really was like starting before I was ready, right? I really wanted to, put it out there and just, connect women. And the first event was over like 30 students. And we just did like a sister circle, so to say, and talked about, our interest in careers and who was struggling with job searching or internships and, just really like connecting and bonding. It was really great. And once we got to graduation, it was funny because people start asking when was the next meeting going to be. Okay. And I was like, that was for school. Like that was fine. I had no true intention though. Oh yeah, I'll do a couple happy hours and I'll invite people. And so I started to do that. And then, I think about longevity a lot. And so I'm like, okay, well, how do I make this sustainable? Like, how do I make this something that people want to be a part of? And I always say money talks, right? So I was like, I'm going to develop out a scholarship. And I connected with a few of my girlfriends who had been a part of that very last meeting. And I was like, I'm thinking about a scholarship for master's and doctorate students in public health. What do you guys think? And all of them were on board. And so we really developed it from scratch. I mean, literally from scratch. And then from there, I'd already trademarked the name. That was really important to me. I didn't want anybody to steal it. And so I was like, well, I'm going to trademark the name. And then after that, I was like, this is a nonprofit at this point. Like this is definitely a nonprofit. And I actually did not want to create a nonprofit. And you can ask any of my close girlfriends. I was against it. I was ready to LLC it. I wanted to be like a business. I was like, I'm not going to oversee a nonprofit and a board and all. No way. That's just too much responsibility. And it's supposed to.
Tell me about it. Yeah. I'm working on it right now. I'm like,
yes.
Anyway, how many people and bylaws? And
yes, and bylaws and articles of formation. And I was like, no, it's not interested. But I did talk to one of my good friends who's a lawyer and a couple other folks who are over nonprofits, and everyone was like, come on, like there's so many other people. You're doing the work. You're already doing it. You just haven't actually registered it. So that point developed out a board, like you said, bylaws, articles of formation, certificate, all of that, like just getting it all together, our contracts and all that good stuff. And I was like, okay, let's do it. People were already outreaching, like, oh, do you have a chapter here or a chapter there? And
oh, wow.
Yeah. So
you were like already doing it like that. Just make it official.
Just make it official. Yes.
Did you, did your lawyer friends help you, or did you kind of figure it out on your own?
Yeah, I actually, my lawyer friends helped as far as, of course, trademark and all my contracts, because, anyone who's a part of the organization, there's, volunteer agreements and there are like, NDA as far as non-disclosure and things of that sort. But they also, I actually hired someone to, I believe in paying people for their expertise. And I hired pay people for their expertise. We cannot do everything. I just posted something today that said, pay people and free up your time. Do not stay 10 hours deep in something. Of course, if you want to learn a new skill, there's nothing wrong with that. True. But if it's not your expertise, pass the buck. is plenty more work for you to do.
Let me go in this wallet and see. Let me see how much money I got.
Right. And that's what I did. I connected with someone who helps people start businesses and nonprofits, and she helped me just do all the paperwork and get everything. Just get everything in order. So it was a little costly in the beginning, but it was well worth it.
Yeah, I'm sure. So tell us about the day in the life of a community health, in public health person, as well as someone running a nonprofit. You do both.
Yeah.
Whatever.
Well, my days are really busy from start to finish, I would say, and so I follow this. I follow these steps each day, and I actually have my journal right here, and I put this in my journal every day, and it's actually must, should, and could. And so I have that's my to-do list. Every morning I start off my morning, obviously after praying and all those things I do, meditating, just clearing my mind, listening to music. But when I'm getting ready to start my business day, I make a list of what I must do, what I should, what I should do, and then what I could do.
Mm-hmm.
So that's how the order that I prioritize that. So my must is like this is a non-negotiable. Like you have to check this off today. My should is like, it'll probably get you ahead for tomorrow, but you don't have to do it today. And then my could is just like it's an item to do this week or next week, within the month. And so that's really how I prioritize. But and then of course I have a ton of meetings, from project managing to consulting to different speaking engagements. So that pretty much keeps me on my toes for the most part. And I try to schedule time to, I have to, right, to really focus on different do outs. If there's certain things that I need to do around sisters and public health, I need to have just kind of brainstorming sessions, or like, what is this, our next move, our strategic plan. I really kind of stay in that to really start working on the next 5 years.
Mm-hmm. That's awesome. What was I gonna say? You talked about like speaking engagements. So like, what for people who are interested, like maybe they want to go that route, right? It's like, I came straight out of undergrad. Maybe I'll put in a few years or a year or two, like get some experience under my belt. But what I really want to do is run my own thing. And so what does that look like for you when you're doing speaking engagements? Like, who are you talking to? Are you talking to younger students? Are you doing like TEDx type, talk happening?
Yeah, so speaking engagements is honestly my favorite. I love to talk. I love to spread knowledge. Sometimes it's stuff like this, right? But typically for me, I do a lot of, and I would say my advice would be to really figure out what your expertise is, for one, and develop trainings and workshops around those. So my expertise is around mental health, and so I have suicide prevention workshops, Your Life Matter workshops. I speak about, mentorship. That's something I like to speak on. Education, furthering your education. And then, of course, Sisters in Public Health is a really common one. But Sisters in Public Health are usually like this conversations. I hardly get asked how to really develop out from, start to finish, right? Nonprofits, because, I tag someone in for that. But definitely scholarship consulting, I do a lot of that as well. So that's really what my favorite thing: scholarship consulting and speaking engagements overall.
That's awesome. So I always ask this question because I like for my guests to be honest, because we can't be like, oh, everything's great, I love my job, but what are we having right now? The Great Resignation, right? Because people are, seeing that there's different ways of working. So give us one pro, or more if you want, but at least one pro, and then one thing that you would change about what you do.
Well, the pro is that public health, you can do anything. There's really what can't you do? Yeah, you can do anything. Yeah. Absolutely. And a master's gets you a lot further than a bachelor's will. So I would say that's the pro. Oh, the con. I can't even think of a true. For my con for myself is that I'm always at capacity. I can say my true con is that I'm at capacity, and so I have to really actively work to dive into my own self-care, my own healing, and my own mental health journey. Because my profession is, and it's just like therapists, because my profession is mental health, and I put a lot of good information out there for everybody else, I'm often giving more than I'm actually receiving. But that comes, unfortunately, with the gig. But you have to really, like, my life outside of what I do professionally, I have to make sure the people I have around me are feeding into me, and like I'm not being drained by the family and friends in my life. So it's pros and cons.
Awesome. And then after that, like, what advice would you give to an up and coming public MPH student, recent grad, or just people who are just interested in public health? Being like, because you 2016 is pretty recent. Like, I came out a while ago. I'm an OG. So like, what would you tell them? Like, what advice?
Yeah. Oh gosh, a few things. Take the opportunity. You've already dropped that a few times on here. I have taken every opportunity. I've lived in Oregon, Vegas, New Orleans, Houston, and now I'm really been remote for since COVID has started. So if I ever get opportunities as these speaking engagements, I mean, you never know what's going to lead to something. You never know who's in the audience or who needs to hear something. So taking the opportunities. With that, internships, I loved internships when I was in school. Most people are going to feed into students if they know that the audience, are students. We want to give, being in our careers already, right? Because someone helped us get here as well.
Right.
LinkedIn, do not neglect that LinkedIn, please. That is your online resume. People are looking at that. I make sure my LinkedIn is up to par. Like, please, 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 if you take nothing else, take that. LinkedIn is your online resume.
Yeah. Out before LinkedIn was out. So I had to, like, you came out, like, you knew LinkedIn before you came out. I had to like work backwards. Same thing like with Facebook. I was just like, that's how old I am. And it was just like, okay, I gotta work backwards and figure this stuff out. Yeah, I got on when it was still new because you had to, for Facebook, you had to have a student email. So I was in grad school, actually was getting my engagement came out, but it was like for the undergrads or whatever. But for LinkedIn, I realized the value of it like way later, and really started ramping it up like a few years ago, and even more so like a couple years ago. But I agree with you. Like, LinkedIn is your virtual resume and virtual like job space.
Yes. Anyone that I interview for my internships that I put out there, I go right to their LinkedIn. It tells me so much. I go right to their LinkedIn.
Like, oh, okay, yeah, this is good. And also, I would say, you know what, I would add to that. That's where potential employers, that's where they're going.
Yeah.
So when you submit your application for a position, make sure that your LinkedIn reflects what your cover letter and resume are saying, because they're going there. It used to be taboo, like, oh, you don't go to, a potential applicant's social media.
Yeah,
Your LinkedIn. Like, so just be mindful what's on there and make sure you're really putting your best forward. Yeah.
Yes.
I agree with that.
Yeah, absolutely. Yeah. And then the last one I would just say is mentors. Mentors were crucial in my journey. I gravitated towards a few great women, and then I also wanted to have male mentors as well. So I pushed myself out of my comfort zone of just being around women to also getting some male mentors as well. So those are, you never know, they'll invite you to events. I attended a lot of fundraisers with my mentors. So that was really helpful for me because I got to meet different people in Portland and Houston and so on that, has helped me, along my career.
Yeah, I'm glad you said that too, because balance is important, right? There's a lot who will be like, no, you need to make sure that you have women mentors, and yes, you need that because it's important to see someone that looks like you. But we're different. Men and women are different. So like what you get from each one is going to be different. There might be more or less, or so yeah, that balance is good.
Yes.
That's good. All right, so that concludes our interview. We didn't have like many questions from the chat, but is there anything else you wanted to share? Anything about your book? Anything about Sisters in Public Health? Maybe an event coming up? Feel free to share it
Yeah,
now.
thank you. Thank you. Well, for Sisters in Public Health, we have expanded to have 6 chapters total. So we have Atlanta, Baltimore, Chicago, Houston, New Orleans, and Philadelphia. You can visit sistersinpublichealth.org to get up to speed on chapter events, anything that's happening there. If you are a master's or doctorate student in public health, we do have an annual scholarship. Last year we did a $1,000 scholarship for one candidate, and this year we did 2 $1,000 scholarships. So please tune in to anything that Sisters in Public Health has going on.
Oh, that's awesome, because $1,000 is good for books.
Yes, absolutely.
That's a whole year's worth of books.
Yes.
So I would apply. All right. Thank you so much, Angela, for joining us here on Masters of Health. Thank you so much to everyone in the chat. Greetings, Precious Stephanie, because I did not greet you earlier. You came in. Peace, everyone, and we will see you in the forward. Next week, we will have Dr. Amina Ali talking to us about some bangs. So thanks again, Angela, for joining us.
Thank you, guys.
This information will be down in the chat. Peace.